In this part, we will review Viora's V-form test procedure. Before receiving a patient for any V-form treatment session, a test procedure must be performed in the enrollment meeting. This procedure serves several purposes, which includes establishing if the patient is an appropriate candidate for the treatment, providing the patient with an opportunity to experience the treatment, and most important, finding the appropriate treatment settings, especially vacuum intensity, and minimizing possibilities for adverse side effects. Whenever treating with vacuum suction, the most common side effect is bruising or hematomas. Although many practitioners perceive test procedures as a waste of time and concerned that some of the patients will not return to the clinic for the treatment, in many cases the test procedure builds a trust conception between the patient and practitioner and ensures effective and safe treatments in the future. The test procedure should be performed at the site of the target treatment. If more than one area is to be treated, a test procedure should be performed on all treatment regions separately. The V-form test procedure is divided into two steps. In the first step, we are going to identify the patient's vacuum comfort level. Set the system to mode 4, the RF intensity off, and vacuum intensity to level 1. On the target treatment area, in the least visible section, identify a zone large enough for the footprint of the chosen applicator of the desired treatment area. Perform 3 stacked pulses on the same spot in the test area. Ask the patient to assess the discomfort level on a scale of 0 to 4, where 0 is no discomfort, 1 is mild, 2 moderate, 3 significant, and 4 unbearable. If the patient evaluated their discomfort level between 0 and 2, and if no adverse effects appear, increase the vacuum intensity by 1 level and repeat the same procedure in the same spot. Continue in the same manner with vacuum level 3 and 4. Determine the highest vacuum level which is tolerated by the patient, meaning up to moderate discomfort level. Now we can move to the second phase of the test procedure that is aimed to validate the chosen vacuum level from the previous phase. Select another zone in the same treatment area, wide enough for 4 footprints of the applicator with about 40% overlapping. Stay in mode 4. Set the vacuum intensity to the chosen level from step 1 and the RF intensity to level 3. Perform the preheating phase of the zone until the skin's temperature reaches an endpoint of 39 to 42 degrees Celsius. After preheating, treat the area for 7 minutes. Assess the area 48 hours post-test procedure for any local side effects such as bruising, swelling, etc. If the patient develops side effects, the chosen vacuum level for the next treatment should be 1 level below. Make a record of the patient's subjective response as well as the skin's response on the patient's treatment sheet. Please note the operator may increase the parameters in subsequent treatments according to the patient's comfort level and skin's response. Thank you for watching the V-form test procedure training video, and be sure to follow up with Viora's clinical team if you have any questions.